Good evening, and welcome to The Caring View, the online health and social care platform, live every single week here on YouTube, Facebook, X, LinkedIn, I think, and our website. You can watch directly from our website, I'm sure that you can. Before we get started, if you're watching on any of our social media platforms, don't forget to give us a like and a follow. If you're watching on YouTube, give us a subscribe. Go to www.thecaringview.co.uk for all of our free resources, our CQC hub, our podcast episodes, our chat shop episodes, everything you can possibly want from us is on there for free. Before we get started, we have to give a huge shout out and a thank you to our sponsors. They keep the Caring Views lights on, they keep us going every single week, and they allow us to provide you all of these resources for free. So huge shout out to Prosperwell, the UK's leading digital marketing agency. If you don't know Prosperwell, you'll definitely know their CEO, their founder, their top dog, which is Toby, Smooth Toby, Tea with Toby. You will know him. If you know him, you know Prosperwell. Huge shout out to Care Business Associate Training, our huge friend and supporter, Paul Blaine's company. Please go and visit them for all of your social care training needs. And don't tell UK Care Week. But we are also sponsored by Care Show London, which is coming up in April. Follow that link there and you can get yourself signed up for your own free entry pass if you work in health and social care. Tonight we're talking about utilising artificial intelligence in care planning, and we're joined by the fabulous Jack White and Lee Truman. But before we get started, I must introduce our amazing co-host, Mark Tops. Good evening, Mark.
Hello. You okay?
I'm good, thank you. I thought you were just going to wave then and leave me hanging.
My sign language all evening.
How are you doing, Mark?
Yeah, not too bad. So it feels like ages ago since we last did a show, even though it was last week. It's really bizarre. I think it's just been manically busy back to back.
Well, yes, manically busy, back to back, and literally absorbing all possible news I can about Princess Middleton. I've been obsessed with that for the last 7 days, and I still am obsessed with that. Not that I'm going to discuss that tonight. Jack White, Lee Truman, welcome to the show. Welcome back, both of you. You've both been on before. Please just give yourself a bit of an introduction. You're both you're co-founders now of a new company. That's what we're talking about tonight. So give us a lowdown, who you are, where you're from.
Cool. My name's Lee. I've been in social care technology sales now for about a decade. So I've worked at places like Care Planner, Unique IQ, NDG AI. So yeah, bit of background, just love working with social care companies. Also like talking about mental health as well. So yeah, that's me.
Lovely. And I'm Jack White, once again, one of the co-founders of Health Automated. Background, I was a military medic, left the forces in 2012, and for my sins stepped into social care, loved it, worked my way up. In 2017, founded White's Training, and about 3 years ago, started the adventure along what is now architecture. Thank you.
No, thank you and welcome to the show. So we're talking around utilising artificial intelligence in care planning tonight. We've spoken about White's Training in the past, and I know we're sponsored by a training provider, but please do go check out White's Training. You are fantastic. But just give us a quick overview. What is Architect? Who is Jack? And what is Health Automated? There's three things there that I want to know more about.
Oh, some good questions there, and it's been shrouded in mystery for a couple of years. But for the past 3 years behind the scenes, we've been curating what we believe is the perfect system for social care. It's an all-in-one management system, allows you to communicate, schedule, person-centered care plans, and it's crammed to the brim with AI and smart features. But that brings us on to Jack, which is the artificial intelligence. I didn't choose the name, but it is named after me, after a famous joke in the company. If you don't know, just ask Jack. Essentially, that's where the name came from, and it's sort of stuck. But yeah, architecture itself is a system now. It's gone live. It officially launched in January. We've seen lots of traction. We've had quite a few social care providers from the length and breadth of England and actually Wales now as well, join in the system, which is fantastic. The feedback's been positive. And tomorrow at UK Care Week, Care Show, but tomorrow at UK Care Week, we are having some talks and we are demonstrating architecture. We've actually got one of our customers who's joining us and is going to share their stories of how it's sort of made a positive impact in their service for the good. So that's where Health Automated is. And obviously, it's not just architecture we've also got the awesome social job finder. Once again, one of the top tech apps for recruitment in social care. I'll let Lee talk a little bit more about that though. So, but yeah, that's where we're sort of at.
Yeah, and I think just going back to it, I think what I seen so me and Jack first started chatting late last year, and as soon as I seen architecture, I mean, the AI stuff is absolutely mind blowing. It's staggering, the automations, but also kind of like the little touches on it as well. So Kara's been able to see things like pay slips from the app, gross pay advice. Kara's been able to book holiday, request PPE for it. All those little touches that, while the AI is the main focus, and it should be because of the automations, the little touches shouldn't be discounted either. But we've got social job finder. So social job finder is a mix between a complex, what that was then, a complex recruitment app and Tinder with hopefully less explicit pictures. But social job finder is also hooked up into architecture. So as soon as an applicant applies for a job, that information is uploaded on there. So again, saving people time, automation. It's got things like video calling in it, so you can do those kind of like video interviews through social job finder, and that can all go on to architecture, just making a nice seamless journey. And then we've also got things like the e-learning kind of integrated in there as well. So again, hopefully just making a really nice ecosystem for the car companies.
Yeah, so I mean, basically architecture is a suite of tools, which means you won't need to go outside. Have multiple systems such as obviously WhatsApp, other messenger systems are available, but that's a classic one that's used throughout social care organizations. When you look at bring your own device policies, it can be a bit of a gamble with communication. So essentially architecture looks at all of these areas and combines it all into one data secure, GDPR compliant, person-centered app. And just following on about the AI as well, because I think it's something we forgot to discuss. Jack actually is very person-centered. Everyone gets their own unique responses. So even the individuals who receive care can ask Jack questions and they'll get logical answers based around them. For instance, like, who's my next carer? How far away are they? They can ask all these sort of questions. And with the predictive decline and the emotion detection and analysis, it's quite comprehensive. We've also used AI to the next level for security features to stop things like impersonation fraud with check-ins and stuff like that. So once again, we'd love to show you all of these features tomorrow. There's just so much there.
Yeah.
No, thank you very much. So much to digest. And I do want to talk about Jack, the AI. First of all, when you spoke earlier around care planning and obviously architecture being full of AI, are you able just to break that down just for anybody that doesn't really necessarily know what AI might be able to do in care planning?
Yeah, sure. So artificial intelligence is at the root of architecture. So it's been built on the most modern stacks available for development, which means the system's highly adaptable, easy to integrate with, easy to roll out. And the AI is at the core. So an AI is an artificial intelligence, essentially a computerized brain that's capable of learning and decision making. Now, obviously, looking at AI, it's becoming a main trend. You're probably engaging with AI through your day without even realizing sometimes. A lot of these call centers, you ring up their AI-based call flows. You've probably seen the amazing work from Google's assistant that can now book appointments for individuals. AI is here to stay, and it should be seen as a companion to your organization, not as a threat. And I think one of the biggest apprehensions in social care is people don't understand AI, so they're not likely to adopt something that they're not au fait with, which is understandable. But we always say, depending on the AI, what the sort of system's capable and how it's taught, the scope is endless. I mean, as an example with Jack's like a virtual deputy manager. You can talk, you can interact with Jack. Jack will give you logical answers. He will chase you. I say he, sorry. Jack will chase you up with things. Jack will send you reminders, and it's all there to sort of coexist in the workplace and try and make life easier for the individuals that, especially those that are office based. It's there to be that supporting hand and take away a lot of the back end tasks and allow them to be automated, which is what we all want. We always moan we don't have enough time, and there's plenty of tools out there now that are going to help save a lot of time and help deliver on person-centered care and allow more contact time with individuals we support.
I think it's just a little bit crazy that we use AI so much in our kind of like day-to-day lives. So I think Spotify announced or launched a new DJ feature which uses AI to put your playlist on there, and it's really cool. It's always playing what I want to hear. When we're in the kitchen cooking, if we're setting timers, it's generally through Alexa these days. And we use Alexa. If someone asks us a question that we don't know, the first thing we do is Alexa. We ask it, or Siri, or whatever your choice of virtual assistant is. But that's not really made it through to the care platforms. They're still kind of like a little bit behind the time. And it wasn't until Jack showed me Jack showed me little Jack. That's careful how we phrase that. But as soon as he showed me, I was like, why are we not using this? Why is this? Because everyone's okay with a virtual assistant, whether it's like say Alexa, Siri, Google Home, the other ones, but it's not made it through to the care software to make their lives a little bit easier by just saying, go and get me a list of calls that are uncovered for tomorrow. And then coming back, they have to do the manual process through that. So again, it's just about time that the sort of care software caught up with it.
I mean, one of the biggest things we hear care managers say on a lot of the demos is, I don't have time to do this. I don't have time to do that. I'm not the responsible person within my organization. And I know I've said this before, but social care is the only sector we get so much bang for a buck for a registered manager, right? If you was to look at outside of social care, a separate HR individual, a separate manager, you've got all of these roles combined into one. And if you're the decision maker at a certain level within your organization, tech might be outside of your scope of confidence. So you may not feel comfortable in committing to a system or choosing a system. And sometimes you may take guidance or recommendation. But what we sometimes find is the time is the critical factor, and architecture gives you more time. So once it's up and running, I mean, one of the organizations that's rolled it out is saving over £1,000 a week through automation. That's a substantial sum. And that's a small service with 8 individuals receiving care and about 12 staff members. So if you was to roll that out across a large organization, not just the cost saving, but the time saving and the well-being increase through the less work tasks is, it outweighs.
No, totally. And this is, we've got April's fast approaching us, and the national living wage is going up at a tremendous amount of money this year. Cost savings are going to have to be something that we think about, and we can't pay people less. In fact, all we want to do is pay people more, and we're going to have to start thinking about frugal ways in which we can achieve that. It seems, I must apologize to everyone who owns an Alexa device at home that has now been triggered by Lee Truman.
I was thinking that. I was like checking my phone. Good old Siri, but
a true story. My stepdaughter's name's Lisa. My other half's Russian, so she has got a little bit of an accent. Not very Russian, but you can definitely tell it's there. So when she's shouting Elisa, Alexa goes off. And we've already got two. We don't need another one, but yeah.
The voice recognition module's still learning at the moment.
Well, it seems like it's another week and it's another AI discussion we're having. I think it's 3 for 3 at the moment. 3 weeks in a row we've been discussing AI. And a couple of times in each episode we've mentioned the word algorithms, and we've spoken about algorithms. And I know that my TikTok algorithm gives me what I want to see on TikTok because I linger a little bit too long on some videos and might accidentally hit that like button or flick through someone's profile. And, I know that that's why that's showing me those videos. When it comes to architecture, how do the algorithms work with Jack? How do your algorithms work? Do they work the same? Are they different? And is there how have you overcome that bias angle?
Oh, now that would be telling. So this is over 3 years of solid R&D. So essentially our AI is custom built from the ground up. It's our module. We haven't inherited any OpenAI ChatGPT. That helps us control the data sets in which we're trying to sort of learn from, essentially. And as what we're trying to actually do is teach the AI to learn in a methodical way, but think like a care worker or a care manager would do. So we have to, essentially, it's like training a child, right? Okay, like if you'd seen some of the responses, so Lee gets to see some of the insider stuff of when we're trying new things. And, sometimes the AI, when it's not fully there, it goes a bit rogue. So this is the beauties of having a test environment and a live environment, because we get to thrash out all of the ways of working and then essentially perfect it before we push it out to the general public. But when you talk about algorithms, there's so many. Now, in architecture, there's 6 independent pieces of IP, from our emotion detection to predictive decline and some of the other modules, which I can't discuss at the moment for obvious reasons until they are protected as well. But essentially, they all have their own ways of working. And we have to try and predict human behavior as part of this learning process. Now, I'll give an example when you look at a language module. Okay, so we can teach the AI to say, show me an individual who may have advanced life decisions. But is that how everyone speaks? It's not, is it? So we have to try and work on variables within the algorithm as well. So we have to try and stress test as best as we reasonably can all of these angles. Now, when we look at the ways that algorithms work, it's mainly flow-based, so based on logic. So if you were to look at, let's just say someone's raised a safeguarding concern through the application. So straight away, Jack, the AI, knows where if someone raises a concern, I've now got to get these forms together. Now, when I've got these forms together, once you've completed them, each one of them will have a separate flow, depending on the response that you input. So as an example, let's just say someone's had an incident and you've completed an ABC form. If that ended up in a staff member being injured or, the individual having to go to hospital or seek medical treatment, when you do select them options, that then gives the different flows for follow-ups. And each time, because the way the AI is designed to work is each organization has their own version. It's containerized. So that way they won't get erroneous data sets from other organizations, or the AI won't learn a workaround, should we say, or how some organization does it and then throw that out for everyone else. So it's all about trying to make it in that way where no one can break it is the easiest way. Now, I'm not sure if you saw, I think it was, I'm not going to name the delivery company, but their chatbot was duped a couple of months ago? Yeah. other delivery services are available. But yeah, so they're
most of you are BPD apparently.
Boom. But yeah, so essentially, we have to try and work on the basis that people will try and do things, to stress test it. And it's a very complex thing, but we have 22 individuals who are working on these algorithms continuously. And we partner with some of the leading AI companies around the globe. As you've probably seen before, I'm traveling here and everywhere working with these individuals just to make sure that our end users get the most safest and secure system with the AI, and it's in the most sort of data compliant and logical way.
No, it all sounds very, very interesting and very kind of futuristic. I want to just take a step back to when you spoke about care providers and AI being the future. I think most of us are digital because of the pandemic. And I think we know that a lot of providers just went digital because they had very little other choice and it wasn't working being paper-based during COVID. How do you think we encourage more providers to then take the next step from just being digital to then being digital with AI? Because I think that, like we spoke about earlier, there's not many providers, managers that have really got their head around AI to begin with, despite us using it every day and things like you spoke about, like in Spotify, it's on Google, it's in our social media. But how do we kind of upskill the workforce that we've currently got to get their head around AI?
See, this is a question I get asked a lot, and it's very, very difficult because to make it work, you've sort of got to change human perception and behavior when it comes to the use of these systems. And because there's not been solid guidance pushed out that's uniformed and a standard where everyone goes, this is what we need to expect. A lot of providers go, well, until I'm told I have to, or until it's in black and white, we don't want to change. So there's that apprehension there, which is rightly so, because they need to make sure that they're doing everything in the right way. But I think over the years, AI has become a mainstream. So since the Chat GPT, that's done the sector a favor, because I'm sure most of your listeners have used Chat GPT for something like marketing, chucking together a post, So people are slowly being desensitized to that. A lot of it's a safety campaign as well, because when we hear the terms AI, we hear decision making subconsciously, and who's responsible for that decision, who teaches that AI to make that decision, but who's the data belonging to is another sort of concept. Now, obviously, we're open and transparent. Your data belongs to you. Even on the back end side of things, it's all encrypted for us. So we can only see things in certain ways, which is with your authorization, and you have to approve it. So that's once again a way as a sort of customer safety step that we take to show you that we can't see it on the back end because you physically have to authorize us to get in. And it depends on the organizations as well, and the trust value and the trust factor. Do people trust the value of the AI, that they trust that it's actually going to do what it says? Because we've all been burned before. A lot of the providers we speak to, unfortunately, have had negative experience with software where they've been sold the dream. This is going to happen. This is going to be there. They sign lengthy agreements and then it doesn't happen. And that causes that apprehension then to the next provider, And I think our testimonials speak for themselves. Our customers are happy. They say the system works. So that builds confidence when we speak to other providers. And the fact that we have customers who will openly share their experiences about the positive factors of the AI is also great to the sector as well, because it shows that some people have taken that step. They've taken that leap. They've introduced AI into their organization, and they can share the benefits, some of the teething issues. But when we look at it as a general, I think everyone needs to be on the same sheet. So about 6 months ago, I put up a post on LinkedIn trying to entice the other providers who are specializing in AI to all come together in a shared capacity to not share ideas, but discuss common ways of working and common standards. Unfortunately, that wasn't met with a response. And this is some of the issue. The providers need to come together and agree a common standard. And I think once a common standard's been agreed and everyone's singing off the same song sheet from a software point of view, that will also help the sector as well. But even things like one-click data migration, that should be a simplified process. But with care software, it's not, because no one wants to work collaboratively on that way, because if I open that, will I lose customers? Maybe, and instead of looking at the positive factors that actually, customers, if they're not happy, they're going to stay with you, but they're not going to be over the moon. They're not going to have that positive experience. You want customers to feel like they can move if they need to, but you don't want them to leave because you're offering everything that you've got and that you're delivering what you say. So they shouldn't need to leave. But I think we definitely need some of the key organizations as well. CQC need to obviously try and get something together when it comes to AI, because a lot of the providers sometimes live in fear of CQC, and they shouldn't. They should feel confident. Come in and inspect me. We know we're doing a good job, but the last thing they want is some inspector to come in and go, "Oh, you're using AI," and then they end up getting questioned on it, and because they're not sure, then they may risk getting sort of downgraded or. And I think that's where it's difficult. But that's the same with a lot of care systems in general, not just by that side. I think a lot of it is lack of understanding. The statistics are staggering with how many organizations still use paper-based. And some of it is the human behavior as well. I mean, some of the ones we've heard, I've got 2 years to retirement, where it's mandated in 3 years. I'll be retired by then. It's a difficult one to sort of overcome, because these people have been stuck in their ways of working for years.
Yeah. I think as well, it's about, there's some education there. What does AI mean to the end user? What is the time saving? What's the money saving, more importantly? But also I think it's about us as providers making AI easily accessible, because if we talk about upskilling, with what we've got with architecture and Jack, it's more accessible than most software solutions out there. So there's not a lot of upskilling needed. And I think that's what it is, just breaking that fear factor, making sure that, it is accessible to all. You don't need a degree. I mean, I'm not very technical. If me and Jack were Breaking Bad, he would definitely be Walt and I would definitely be yelling AI. But I won't finish that because before 9 p.m. But yeah, I'm not a tech guy. I'm a people guy. I know people, and I can use the system really, really easy. I don't get tripped up about the AI. It literally says what it's going to do, or it asks you, and it gives you the results that you want. So again, I think it's just about breaking some of that fear and just making it accessible for everyone.
I mean, I'd love to hear what some of the viewers' thoughts are, because some of them would have tried AI. Some of them have probably got positive and negative experiences. But I mean, everyone's an individual and will experience AI in their own way.
Yeah, definitely. I think a lot of it is fear of the unknown. I mean, you talking then around being able to transfer information at the click of a button. For me, I ain't part of the NHS assured provider list, but I would be making sure that actually part of the condition of being on the NHS assured provider list for supplying these sort of softwares out there is the fact that actually they're really easy to communicate across systems, because I've had one where it's literally ridiculous on having to download your information from it. You've got to jump through hoops. I've got another one where I'm trying to think whether I still use this one, where you can't just export. You've got to download the API, and then you've got to link it to something else, and it converts it to this file, and then you get your information. And it is just ridiculous. And all I want, and all our residents want, and all our team want, is to be able to click download. I've got my information there. I can then send it off elsewhere should I want to. And they make it incredibly difficult. And the point you bring up around the Care Quality Commission, our regulators around AI, and I would even go as far as saying the ICB around safeguarding, around digitising social care, there's still a lot of unknowns at the moment. And I think people who are regulating us aren't fully versed themselves. And they will get themselves tripped up with concerns that are going on. And they will get themselves in a quandary. I think for me, the biggest conversation to have tonight for my side of things, and please don't think any less of me, is I've always been one of these people that I've gone, I ain't never letting AI write a care plan for me. I ain't never letting that happen. I think care plans need the human touch. I want to be able to control what goes in these care plans. I want to know this person, and I want to learn about them, and I want to build that plan with them and develop it. And I'm not trying to tell people not to use Architect at all. I'm hoping you're going to turn my brain around and go, oh, actually, Adam, we used to think like that, and this is how it does. What is the future of care planning in your mind, and how does your AI care planning not affect that human side of things?
Well, you're correct in some ways, because we won't allow an AI to write a care plan either. There's no complexity, no complex AI that's good enough at this moment in time with the data sets available that could write a cohesive care plan that's person-centered about an individual. That takes a lot of machine learning the individual. There's too many variables. So as a safety point of view, our AI can collate data, but you need to check it. You're the responsible person. You need to make sure that everything in there is factual. I always say, whenever you're implementing AI, give it the 3-month probation process like you would always give a new member of staff. Now, people look at me like I'm crazy when I say this, but I'm going to explain it. An AI needs data. So like a new employee, the first month, you program them with data. This is what we do. This is how we do things. By month 2, you expect a bit of a reasonable amount of autonomy. So it's like, okay, we've shown you some of the basics. Let's see what you can do. By month 3, you expect that person or the AI to be quite competent within their role and doing things. But once again, AI is only as good as the data it's fed. So if people aren't using it properly, or they don't, it's like any care planning system. Take away the AI. If you don't put in the correct medication timings, for instance, you're not going to get the alerts to know someone's missed it. So it's one of them sort of principles. Now, the way the AI works, I can't go too much into the predictive decline side of things, obviously, but essentially it looks at the individual, it looks at their needs, their requirements based on things like their comorbidities, their previous diagnosed conditions, medication. I think there's about 120 variables off the top of my head that it's always looking for that individual, and then it will recommend. So after you've initially put information in, at your next review period, it will say, these are the forms that have been put in. These are the risk assessments and stuff like that, and essentially it starts to learn what you're putting in, but also your ways of working. So if you start to, let's just say you use a specific form when you're onboarding an individual, after a period of time, it learns that, well, that's the norm, if you will. We put that form with there, so it automatically do it. You know, it's I wouldn't trust ChatGPT to write a care plan. I barely trust ChatGPT to write a marketing post, if I'm honest with you. I always have to go and change it. It uses words that are anomalies. But with care planning, we're moving away from task orientated, right? So obviously we have to look at where the person's at, where they need to get to. We understand that sometimes tasks are unachievable. So to try and teach an AI to work in a task orientated way would be unethical, because essentially that person may not be able to achieve them targets, if you will. So we've training it in a flow that works with a more person-centered approach and recommendation based more than sort of scoring, if that makes sense.
No, definitely. And I think that's a good idea that you're saying it's a recommendation, it's not the actual. In terms of then taking it one step further in that care planning, can it then predict kind of outcomes for risk assessment? So will it identify maybe somebody's had a fall X amount of times, actually you need to be recommending that a risk assessment for falls is put in? Does it take it to that next level around risk assessments?
So actually, it's quite complex now. We've got a new part coming out in about 6 weeks, and it's a major update. Well, upgrade, should we say, with the way the AI learns some of the predictive decline tools. But essentially, you're right in what you're saying. So it learns, like, by certain sort of conditions what forms may be required or support may be required. You know, so I'll give you an example. If you tick someone as a wheelchair user, straight away the AI goes, well, do they need 2 people to assist them move? You know, so it starts to calculate then and starts to work out, like, if you need double up visits, for instance. You know, it's quite sophisticated. But once again, it's a learning process. And from where we are now, in the next 18 months, it's going to be huge. We've got some key developments. We'll share them with you tomorrow. And I think you'll be like, wow. But AI is just there. It's there to be trained. And I think, you know, companies can learn to benefit from it in their own way, whether that's they want it to automate processes, start the care plan side. You know, it's adaptable.
And I'm assuming when we talk about machine learning, when we talk about something, say, like ChatGPT, we talk maybe input and we'd say about somebody in a wheelchair doesn't need 2 carers. We put no. Next time they'll probably remember, actually, you don't need 2 carers. Obviously, with your system, with architecture, I'm guessing that it would forget that actually Mrs. Smith doesn't need 2 carers, but Mr. Whatever might need 2 carers. So it starts that whole learning again per individual.
Right, so there's a thing with AI called, like, a positive learning loop, or continuous learning loop, some people refer to it as. And essentially, you may have seen this on ChatGPT, where you'll ask it a question, it'll give you an answer, then it'll say, was this correct? You know, so it's asking you. So if someone says, yes, that's correct, the AI goes, I've done a good job. Now, next time someone tells it no, it's a bit sort of like, hold on, it gets a bit confused. Jack is designed to work on a learning loop for each individual person. So it shouldn't look at one person's sort of data set and go, but this is a standard approach for everyone else, because it remembers that person-centered approach. So if we use, in our case, on our app, don't we, Anne Jones. Anne Jones, everyone who's done a demo with us knows Anne Jones. Anne Jones is our individual who has all of the data, and there's about 3 service users who have none. All right, so Anne gets everything put on there. But obviously on that side, Anne's AI responds completely different to how it would look at one of the other care receivers, and, you know, and give data and answers for them. It's pretty clever stuff.
I'm not gonna lie, I'm getting completely lost on a lot of this. I try and understand it, and I try and act like I know what's going on. And we've had a question come through here, and I'm just like, no idea. So I'm going to bring it up, and hopefully you can help me. So, what if the AI-enabled care planning software is being fed the actual real data through IoT and not reliant on human input? No idea. Explain the question to me and then give me an answer.
Also, before Jack goes, because I'm like you, Adam, I'm lost. Nadia is from Spark, so they're doing some really good stuff in IoT. So yeah, one to watch out for as well. But
for those that don't know what IoT is, the Internet of Things. So like smart devices, you know, so there's been leaps and bounds in these sort of developments over the years. Obviously, we've all probably seen the ones for like fall detection, where you've got like some of the cameras around services with sensors. You know, now obviously it's a very difficult question to answer that, because one, it depends on the devices that are feeding the data. So could that be something like for instance, an Apple Watch? Other brands are available, but with things like you know, pulse rate, heart rate, ECG being fed in. Now, to be fair, there's always going to have to be some, from my perspective, human oversight when it comes to the data being fed in, because we need to continuously check that the data is correct. Because if we leave it just to read, you know, if we don't pick up on anomalies from an early age, should we say, then that snowballs and the AI can learn from their mistakes and think that they're the normal, if that makes sense. And it takes a lot sometimes to try and train the AI away from that. Now, if it's been, I mean, Jack gets fed data from some other sources, from some smart devices and stuff like that, and it works quite well. It's quite seamless. But once again, why AI is learning. So for the next 2 years, we are asking individuals to manually check the data, but also to approve the data. Sorry, I've seen Nadia's come back. That's the idea of MDTs, reading and signing them. Sorry, Nadia, could you explain MDT? Sorry, in case I'm
presuming that, well, I'm hoping that means multidisciplinary teams.
I was going to assume that was multidisciplinary teams. While we wait for Nadia's come back, Paula has also put it's not a question, but just a reminder that we must remind managers that World-led Quality Statement 7 is learning, improvement and innovation. CQC actually say we should encourage creative ways of delivering quality of experience.
I think this is a huge point as well. So not to divert from the AI care planning side of things tonight, but just a reminder to everyone, the new CQC framework is in play. It's out there. It's being done. The old one's gone. You're never going to get inspected like you used to be inspected before.
Wow, you do say that, Adam, but there are managers messaging saying that they're still having the old framework.
Yeah, so again, I haven't got enough data to go on that. I know some people I've spoken to have said, well, we've been done under the old framework, but it's been published in the new one. And I was like, but it will be published as the old framework because you're inspected prior to that launch date. There's a lot of ambiguity around there. And until we get enough data about this, I don't know what's truly going on landscape-wise. If you are, by the way, on the new CQC portal, please let us know, because we can't get on. I cannot get on. I have tried every single day since last week, and I am still not on the new CQC portal. Anyway, I digress. My point was, quality statements. So we need to be thinking about these quality statements every single day now. The evidence that gets collected from the CQC is going to be vastly different. So it's not just going to be based on our inspections. I was at a workforce conference today where we were talking around T-level placements, we were talking around nursing associates, we were talking around placements for OTs and SALT and all that sort of stuff. And actually, part of the well-led statements are, how can you prove that you're working with other partnerships outside of your organization to improve the seamless effectiveness of your service, or something along those lines? I don't know them verbatim yet. And actually, if we use those quality statements to benchmark everything that we do, so I want to introduce AI care planning into my business, right? How does that relate to the quality statements? What quality statements am I going to meet by introducing this new technology? Like Paul has said, you know, quality statement 7 in well-led is around that innovation and how are we encouraging that innovation? And it's just really good to keep cross-referencing against those quality statements. It's a lot easier now because there's only 30 something of them, where there was like 130 before with the Chloe's. There's only 30 something of them. So it's so much easier for us to be able to use that to then go, right, the reason I'm doing this is this, and this. It satisfies regs 1, whatever, and quality statements X, Y, and Z. And it's making it a lot easier for us now to justify where we're at. And all of that waffle, Nadia has come back and said, yes, it's MDTs. So does that make sense now?
Yeah, so obviously we always recommend everyone checks all of the decision making from an AI. another one just following on that as well. I know Sonia Ray's previously mentioned this on panels, and it's making sure you have your policies and procedures in place to inform the individuals and your employees that you have AI there, and especially if it is involved in some form of decision-making process, that is essential. Because obviously I'm not an HR guru, but judging by what Sonia said before, it could leave you in hot water. So just make sure, obviously, you've got all of that ready to roll out if you are using AI.
Yeah, and again, not trying to scare people about using services like yourself. One of the first things I ask our digital software providers are, can I have your policies? Can I just know how you're using data? What's your information governance policy? How is it going to be shared? What's all this information? Because I can log that within my business continuity plan if anything goes awry, and I've got that information already there. So it's not just our own internal policies, it's actually everyone else that we use and their policies as well. I did it during Brexit, and I used to phone up all our suppliers and go, right, what's your Brexit policy? What is your contingency plan for Brexit? I need to know because I use your services, and I need to know what my contingencies are going to have to be if yours fail. So it's really important that we get to understand what everyone's using our data for. Mark, I think we've got a very, very basic AI policy template as part of one of our download documents on our website. That was done 4 months ago, and AI has literally grown 15 years in age since then. So I think
I was literally just looking for it. I've got the link, so I'll share it in the comments. But yeah, it's a AI guide or a guide to AI in social care. But yeah, no, there is a template at the end of the document that links you to a AI usage policy. So it's not going to be something that you can just pick up and then implement. You're going to have to read through it, add your service details to it, make sure that it obviously ticks all the boxes. So, but yeah, it'll give you the structure for you to actually
start at 10.
Can I just follow on for that as well? Following on from what you said, Adam, a quality data protection impact assessment, a DPIA, before migrating to any system should give you a good understanding of what that provider's going to be like with their service level agreements, their contingency plans and stuff like that. So I would always recommend that you have a strong DPIA. I know it's not my field, I know it's more Michelle's field, but obviously we always recommend people to have them in place just so that way we can help advise if they've got all the bits that they may need as well.
And I know people think, oh God, we're being a bit dramatic here and there's loads more work for us to do, and it's really, really scary. If you are in the Leicester region, you will know how important this is. Leicester have had a massive cyber attack, huge cyber attack. I can't go and speak about it because I have homes in Leicester and I don't want to say stuff that might not actually be publicly known, but it is huge enough to be on the news, huge enough to basically shut down a council for the time being, and nothing is accessible. We don't know where it's come from, we don't know who's doing it, we don't know the reasons behind it. All we know is an entire city council systems have been hacked, and if they've got all of that really structured infrastructure there, that really rigid process in place, those little lowly care homes that might have McAfee antivirus software on our computers, and that's it. We really need to make sure that our business continuity plans have a separate section now, not even just a little bit around cyber. We need a full shebang on cyber continuity plans. What is it around data privacy? What is it around our systems? What happens if our care planning system goes down and we can't access that information? What happens if there's data leaks? What happens if there's breaches internally or externally, or the providers that we use have data breaches? We need all of this now in our continuity plans. And I know you're all looking at us now at the Care and View going, well, where's your template for this business continuity plan? Give us a minute and we'll make one. I'm sure we will, because I'll probably want to implement one in my service, and I'm sure I can whack a template together. But it's really, really important now that we don't take our fingers off the balls. And if any of you are sat there and you are small providers and don't understand what I'm about to say, as soon as you get off this call, Google it and sign up and register to the ICO. You need to have a registration, a membership, or God knows what it is, a certification, a validation, I don't know what they call it, to the ICO, which is the Information Commissioner's Office or something. Big must, big no-no if you don't have one. Make sure you go and do that, because I don't know why we do it, but we have to do it. Jack, can you give us more of a reason why we need to have an ICO certification?
So the ICO basically oversee, I mean, once again, not my major expertise, but we obviously we comply with their legislations and we're registered with them. So essentially they oversee data protection legislation, and obviously can take enforcement action against organisations who are in breach. Failing to register with the ICO can lead to a big penalty. And obviously if you're dealing with healthcare or that sort of related data, financial, criminal history data, these are protected categories, and the ICO don't take too lightly if you're not registered. I believe, now don't quote me on it, CQC check now was part of the registration process, maybe.
Possibly.
They should do, especially commissioners as well. But yeah, definitely, I think it's like £40 for a small organisation. So it's not.
It's really not much. It's really not much.
And I think as well, aren't they?
Yeah, charities are free. Small organisations, it's not that much money. And you might be thinking, oh, once I've signed up, what do I do with it? Because we've just signed up. Shove it in your policies. Shove it in your contingency plan. Make sure that in your data protection policies, your privacy policies, we are registered with the ICO. This is our reference number. Go and search us. Because you're giving that information out. It's candor, isn't it? You know, you're telling people we're being open and honest around our data protection, our IG here. So shove it in your policies, shove it in your BCP, and make sure that that's known to people. Have it up in your front entrance. We have our liability insurances up. We have our CQC inspections up. We have all of this other stuff up. Have it up there to make sure that people, when they come into your business, know that you're registered with the ICO and they know that their data is safe. Because more and more of our stuff is going through digital data now. It's a huge thing to just reassure people that we are safe. So really good. Hannah Montgomery's come through saying 35. Oh, I think Mark and I tried to do that at the same time. £35 if you sign up for a direct debit. Cheaper, and you won't forget to renew. Love that tip. Love that tip, Hannah. Thank you so much for that. Mark, over to you.
Yes, just wanted to touch on one thing that Jack mentioned earlier. He mentioned somebody called Michelle, and I think there'll probably be people thinking, who's Michelle? Is she another AI? She's not. It's Michelle Corrigan, and she's the program director at Digital Care Hub. So she has joined us on the Caring View before, both in person and on a live stream like this. She is willing to support anybody when it comes to the rollout of AI. So if it's that you want to know more about a privacy statement, or you want to think about actually want to go down this route, what do I need to consider? Something like the ICO, she's more than willing to offer support. And there are teams that she's got around the whole of England, and I think Wales and Scotland, that can support you with that as well. So you can find her on LinkedIn or via the Digital Care Hub website. We do have a contingency plan on the website, but I don't know whether it includes anything around AI. It will include stuff around digital, but we probably do need to look at that and review. Adam, were you going to come in then? Sorry.
Yeah, just one massive plug for our Michelle Corrigan as well, because we are huge Michelle stands here. I love Michelle Corrigan. And a wealth of knowledge, fountain of knowledge. I lean on Michelle and her team. They're incredible people. Dan especially has helped me through some really difficult stuff. We do have the DSPT podcast on our site. You can go and listen to that completely free, and that's all around the questions that are on this year's current DSPT. And I'm sure the deadline's around the corner now for us to get that completed. If you have no idea what I'm talking about, the Data Security Protection Toolkit helps us put together those processes to reassure other people that we're doing what we can do. It's it's not mandated, but you really should be doing it. You get your NHS mail through all that sort of stuff, but it just gives you those sort of ideas. It's like any audit. We do audits to show what we're not actually doing. Audits are learning tools for us. They showcase what's working well, but actually it brings up themes, it brings up trends, but it also highlights areas that we might not actually be compliant in. And the DSPT is amazing for that, because it's like, how do you get rid of all your data? Ooh, probably never even thought of that. Are you registered with the ICO? After tonight, yes, you will be. But if you're not, and you go to do that DSPT, it's on there. It's a question. So it's a really good toolkit to be able to do that. And if you do get confused and you do get lost with it, go listen to the podcast with Michelle Corrigan. I think it is series 5. I might be lying. It's 4 episodes, really, really useful. And we just basically walk through that DSPT, because using systems like Jack's architecture here, you really do want to make sure you completed that DSPT, so you're fully compliant with all of your data and information and privacy requirements, that you possibly need to be. Different levels to be able to do it. Not going to go too much into it, but yeah, check out the DSPT as well. Sorry, Mark.
No, that's okay. I'll pop a link to the show that we did as well in the comments in a minute. I'm a bit worried they all come blaring out on my device, so I'll mute when I do that. The other thing we do have on the website under the resources are the Word documents that you can use when you're going through that DSPT sign up. So there's 3 sections: IT systems and devices, there's policies and procedures, and staffing and roles. But you can download them, and there's full of information and links to signpost you to relevant policies and bits and pieces to help you on the way. One question that popped into my head when Adam was talking earlier about training was around, we'll have a lot of managers that might be using ChatGPT, and from what I hear, I think they're kind of dabbling in it. Probably not much training. And I think there was a survey, and I can't remember who did it. I remember I shared it on my LinkedIn last week, that found that most UK workers are using AI, but their company doesn't have a policy and they haven't been trained on it. What would your advice be, Jack, around if there are care providers looking to provide training to their staff, the kind of things that they should be looking for to make sure that's included? Sorry, putting you on the spot there, but...
No. I always say, don't introduce systems that you're not au fait with. You know, where there's a lot of AI ones, some of them aren't the most honourable online. Some of the data is not safe in there. You know, you shouldn't be putting any sensitive information into an AI that, one, is not sanctioned by your organisation, and you've got no policy or legitimate purpose for using it. But 2, obviously, if you're not sure of how these systems work, how do you know you're in breach of data protection for your actions? And obviously, when it comes to cyber security, it's a sort of big issue, and AI sort of comes into this as well, because people look at a lot of websites and think, oh, that's fine, it's online, it's not giving me an alert in the browser, so it's got to be safe, you know, stuff like that. Then they start submitting data into it, and then obviously that data ends up on places like the dark web. It ends up in databases that are then sold on for marketing, and I would always say, as an organization, don't use any systems that your organization hasn't sanctioned. That way you're going to stay on the right side of a disciplinary. But equally, you know, if you do feel a system is of benefit, and speak to your organizations. You know, organizations do thrive on hearing positive feedback, and if it's going to be a benefit, you know, pass it to the decision maker, let them make an assessment. But yeah, just don't touch anything that you don't know or don't or may not be secure. And for God's sake, always make sure that the data is stored at least within the UK and it's GDPR compliant. A lot of people use servers that are based in the US and stuff like that, completely different data regulations, and that healthcare data no longer belongs to you. Let's put it that way.
Just touching on that, I'm not going to name the companies, but there are a couple of care planning software companies that data isn't stored in the UK. Where do providers stand on that then? If maybe they've signed up and maybe it was held in the UK and it's now changed in terms of the data for their staff, themselves, the people that they support?
So I'm going to go in loosely because I don't know all the facts on the stories on this side. But essentially, if an organisation's making some form of data change which could impact the other users, they should be communicating with the organisations and explaining the methodology. As long as it's stored within the UK, EU, you know, comes under GDPR, but preferably if healthcare data, you want to keep it in the UK. And one thing I will say is don't put your eggs in one basket with where you store your data as well. Make sure it's scattered around different regions within the UK in data centres, so that way you're protected in case of any offline in, you know, terrible weather, floods, that sort of stuff. But yeah, if you as an organisation and your data is not being stored compliantly, you have a right to raise that as a legitimate concern, because obviously that could put you as an organisation in breach. A lot of the organisations have to make sure that they're following certain things, so like Cyber Essentials Plus, ISO 27001. You know, there's a lot of safeguards in place. You just have to make sure that your data, because ultimately you're responsible for it as an organisation, is stored compliantly. So that way, if you get audited, you can justify it.
And that probably comes back to the DSPT, because actually, if you review it yearly, that's one of the questions on there around where your data is stored. So we have shared the link to Series 5 on the podcast, and we have shared the link to the YouTube event that we did with Michelle. Last question from me, because I'm very conscious of time. We've spoken around the benefits for care providers in general, benefits for managers. What are the benefits for care staff? How does AI in care planning benefit our frontline staff? Lee, I think this is over to you.
Yeah. So it's just the ease of use. Like I say, instead of going onto an app and having very limited information, all the information's there at the fingertips. It's like I mentioned earlier, it's kind of having the ability to pick up extra shifts, to have a look at those policies, procedures from the app without needing to ring the office. We've got a bit on the app which is the sort of assessment centre, so they can have a look at the initial assessment, they can have a look, care plans, risk assessments, things like that. So having all that in the hand of your palm without needing to ring in the office, and they can even silly things like go on to a visit and they can see who the next carer is with Mrs. Jones. So if Mrs. Jones says, who's going to come and see me next, the carer doesn't have to go, let me find out, pick up the phone, call the office, and just pick up the phone, scroll down and say, oh, it's me, I'm coming in next week, or whoever it is. So I think there's a lot of convenience factors as well. And if there's any sort of dispute, so if your payslip says you've done sort of X amount of miles, you can ask Jack the AI, how many miles have I done this month, and you'll get that information there. So I think a lot of things that will sort of ease the burden on the carer a little bit, and again, we need to make sure we're doing everything we can to look after the well-being of the carers.
But it's also the care receiver. The care receiver gets benefits from it as well. So as Lee's just explained, the care receiver could say, when's my carer going to arrive? And it will tell them, and it will show them how far away they are. So excuse me. So it stops all of them calls into the office. It's just them little things that we're trying to prevent to make life a lot seamless.
Communication. Sorry. That's what I was going to say, Adam. Communication. It just improves the communication.
Yes, definitely. So one last question from myself before we let you get back to prepping for UK Care Week 12. I've probably got a second question actually, but it's about tomorrow. Where do you see this going? Is there going to be some sort of technological plateau that we're going to hit with AI? Because we think about this, and I suppose it's a difficult one, because what can we innovate? What can't we innovate? What can grow? What can't grow? But surely there's going to come a point, and maybe this is my narrow-mindedness, where we can't do any more. Like, we just literally physically and digitally can't do any more. Do you see like an AI plateau happening anytime soon? We saw it with VHSs, because actually they could only store so much information, and then boom, we had DVDs, and boom, we had Blu-rays. And I mean, their lifespan, the half-life of DVDs and Blu-rays was minimal, because then came streaming, and streaming is now the go-to, and there's not really anywhere else for media to go in regards to that, unless we're going to talk around VR and AR. Other than that, or holodecks, if we love Star Trek.
It's doing full circle, Adam, music. I read the other day that Taylor Swift is bringing back the need for vinyl. So vinyl sales are going through the roof.
Taylor Swift could wear Crocs, and all of a sudden they would become a fashion icon. Taylor Swift could do anything, and the billions.
I always thought Crocs were a fashion icon.
Sanjay, if you're watching, are Crocs a fashion accessory, Sanjay?
But I got asked the question the other day, right? So DVDs or VHS, what do you prefer? I prefer a VHS, because how many times did you scratch a DVD up by not putting it in a case and stuff like that? So you can understand why people go the retro.
Yeah.
It works.
But when it comes to this week, is there going to be a plateau? Do you see a plateau happening? And where do you see your software going?
I think sort of, so if we go back, I think software had plateaued, and I think it's still kind of in a plateau for a lot of the cases. So people will talk about innovation in software now as being things like a best match feature, where you have some outdated sort of logics matching them up, or they'll still be talking about drag and drop, or stuff that was kind of like really cool in 2015 and even earlier than that. But you couldn't have developed AI in 2015 because the landscape, the technology landscape had plateaued as well. It wasn't until kind of like the implementation of AI that there's another way for the software systems to go. And I think it's going to be interesting in the next 24 months. I think it's going to be sort of a lot of companies struggling to catch up with AI. And I think what you'll also get, I think what the danger of end users is they'll have someone who's got an older system and they'll ram AI in it somewhere just so they can put on the advertising, the marketing that it's an AI-enabled system. Was like there's a difference between it being wedged in somewhere, can we fit in? That's like when you're packing the car, isn't it? For when you're doing car week, you're trying to get everything in. But I think with architecture being, we've got the AI central to it, and then everything else is built around it. It is that smooth kind of like native AI. So I think it's going to be, just a very interesting 24 months.
See, bolting on an AI is like a human with a robot arm. You know, it's there as a, it works, it serves a purpose, but it's not built for you. Whereas if you build a system up there, it's there. But a simple answer to your question is, when there's no requirement to change, that's when software will plateau, because, we won't need to develop anymore. When the perfect systems are there and we've solved all of the problems, why do we need to change, right? But until that point, AI has got a long way to go. And it's only just started. It's the tip of the iceberg. We're going to see AI care robots soon. In the future, we're going to see all of this stuff that's going to just help, and we're going to learn to coexist with the technology.
I mean, I'm dead excited to see where it goes. And everyone who knows me, I'm a massive geek, like a huge, absolute bona fide nerd. And if AI will get to the point where generative AI, because this is how I see holodecks working, in Star Trek, where you have your holodecks and it produces imagery and stuff like that. If we could get generative AI, and I know there's already haptic feedback systems out there for, game players and stuff like that give that sort of response back. But I'm thinking training-wise, if we could wear devices that actually simulate, neuralgias or other sort of medical conditions, so we could actually experience them ourselves, so that if we're supporting people with dementia, we understand what that pain would feel like and use it in that sort of regard, then training is just going to open up tenfold, isn't it? Understanding those sort of pain receptors and the pain management of people. It's dead exciting. My second question is probably less exciting. What's your stand tomorrow? If we want to come and see you at UK Care Week, what do we have to look out stand number wise? And Jack's face tells me he hasn't memorized it.
There we go.
I have
J50. So we're at J50. Don't forget, if you can't make it to UK Care Week, to check us out at healthautomated.online. Follow us on LinkedIn, Facebook, X, and all the other channels. But
if you can make it, come and see the house that Jack built, have a go on architecture, and look at our AI created explainer video that will talk a lot about what we do.
Yeah. Amazing. Honestly, thank you both so much. Mark, any final words from yourself?
No, just thank you very much for giving up your evening and coming to talk to us. And I'm really excited to see where AI takes us. I think, like you said, Jack, actually, it's just the beginning. And I think sat in a year's time, the landscape is going to be very different to where we're at right now. So I think definitely you need to be on the wave as opposed to behind the wave, so to speak. So.
I know we keep joking about it, Mark, but I'm dead keen to hopefully in, say, 12 months' time do an AI-generated Caring View podcast episode just to see how well that works. I know the Screen Actors Guild and all those sort of people will be screaming, going, no!
I reckon with AI out there, we could do it already. I reckon there's systems out there that would allow it.
You could.
That is mad, absolutely mad. Look, honestly, thank you both so much for joining us. I know you've got 2 very busy days ahead of you. Mark, I know you've got a long drive now up to Birmingham this evening. I'm not going until tomorrow morning. I'm just going to try and brave the traffic first thing. This has been The Caring View, www.thecaringview.co.uk. You can find out all about our sponsors on our webpage. Just check down on the footer or on the sidebar. We have Prosperwell, we have Care Business Associate Training, and we also have Care Show London. Mark, we are live next week, and I want to say it's human trafficking, but I'm probably wrong.
I think you are right. We are joined by somebody from Essex Police to come and talk to us around human trafficking. So I actually went to a care conference and heard this this member of police talk about actually social care and human trafficking and the kind of the rise since international recruitment. It kind of really opened my eyes, and I thought actually it was a really good conversation to be heard by the masses as opposed to just a handful of people. So yeah, no, I'm really looking forward to that, and I think it's a sad. It's not going to be the most fun of shows, but I think it will definitely be an eye opener to the number of cases that we're seeing. I think it's definitely one to watch.
And it's definitely something that is at the forefront of everyone's mind at the moment. I know locally we had some modern slavery training recently within the Lancashire ICB area, and I think it was the most attended training they've put on for a long, long time. And it is around those concerns of how do we protect these people coming into the country who are coming to work for us, and how do we make sure that we're not buying into this. And I've said this since day one of international recruitment. Although it is a good answer, I do fear of this idea of colonialism and this idea of people trafficking and this idea of actually putting these people in really precarious positions, not with the support that they need, in hostels held up in multiple rooms, or even no fixed places of abode. So actually, what do we need to be thinking about now in regards to international recruitment and people that are coming into this country to work in the social care sector? So yeah, probably a more toned down episode next week, but a really, really important one. So please do join us live at 7:30 as always. J50 tomorrow to go and see Jack and Lee. Mark and I will be wandering around. I think Mark's doing about 50 million talks this UK Care Week. Do come and join us at our talk at, I'm going to say 11:15. I don't know what stage. Mark, what stage?
I don't know. I won't lie. I turned off my other laptop, so now I don't have the details. But now you've got me on the,
You'll find us. You'll find us. We're talking about the CQC framework. Very interactive. We will talk about what we know, but actually we want to hear from you in the audience as well. How have you found the CQC single assessment framework so far? Have you had your inspections on it? Are you on the portal? That's what I want to know. Are you on the CQC portal? If you are, tell us what it's like. This miraculous, mythical land of CQC portalness. I want to know.
So yeah. we are on the business facilities and environment stage at 11:45 to 12:35, and there'll be a lot of takeaways as well. There'll be a lot of top tips of how you can get ready for your next inspection. So I think there's 30 tips that we've got that we can easily share that you can take away and you can start embedding when you get back to your service on Thursday or Friday. So yeah, be sure to come and join.
Perfect. Wonderful. Until then, good night, everyone. Take care. And if you are there, we will see you tomorrow at UK Care Week. Take care, everyone.